He's the Group CEO of Amref Health Africa, Dr. Githinji Gitahi. Doctor, thanks again for staying with us. Appreciate your time. I know you are bogged down with work. I'm going to start with a tweet by Dr. Ahmed Kalebi earlier on today. He said, listen to this, at day 35, the confirmed COVID-19 cases in Kenya are tracking higher than Italy and Spain, which went on to explosively surge from day 45, while France, UK, and the USA surged from day 55. In the coming 10 to 20 days, we'll know whether hell breaks loose or we dodge the bullet. Your thoughts, sir?
I think the terminology dodge the bullet is a bit presumptive, because we know that the infection and the spread of the coronavirus will continue. We have closed our borders, so now we have a finite number, but that number, every single person who is infected is estimated to infect 3 people. And that is why when you slow down movement, then you reduce that rate of transmission, or what we call reproduction. So we know that we will continue to get people infected, but the aim of all the measures that the government is taking is not to dodge the bullet, as you say, or to ensure, or to make sure that people don't get infected, is to slow the rate of transmission. This slowing the rate of transmission is what then we refer to as flattening the curve. Remember that if you left any country as it is for the next 2-3 years, you don't introduce any vaccine, you don't do anything, and you leave it as it is, it's likely 100% of the people will get infected. But that doesn't mean that they are all going to be symptomatic or they are going to require critical care. It will still be the same ratios will require critical care, but more and more people will get infected. But as more and more people get infected, more and more people develop immunity, even if there was no vaccine. And therefore, they reduce their chances of reinfection as you go along. And that's what people have been referring to in some countries as herd immunity, meaning that you have a significant amount of the population infected to stop a significant continuous spread of the virus. But therefore, what Kalebi, who is a friend of mine, is referring to is, maybe what he's calling dodge the bullet is our acceleration phase going to decelerate? The infections will continue, but it's going to be low enough not to overwhelm the health system. That's what we are looking at, which is why the government is taking the measures it's taking to reduce movement.
All right, let's focus on Mombasa, Dr. 20 cases in the last 3 days. Is there cause for alarm there?
Yes, there is. There is huge cause for alarm, Jeff. And the cause for alarm is that it means that even with the measures that we are taking, Mombasa is already in, a kind of a red zone. It means that transmission is still going on. It means that even as we allow, the strategy Kenya has taken is to allow business to continue under certain measures, encourage people to stay home, discourage aggregating, but allow business to go on, and then put measures like wear your mask. But it means that the measures are either not, working as they should. Maybe they are, because we could have seen maybe more cases, but they're not working as they should. And therefore, we need to, the announcement that we are going to review, or the government is going to review the measures taken and maybe make them more stringent, is a positive way. But remember that this whole thing is not about the government. And this is really what I would like to talk to Kenyans about. That this thing is about you and I. It's about each of us. So the fact that you're in Mombasa and you escaped curfew and you managed to go to a bar and have a drink with your friends doesn't make you a hero. It actually makes you a reckless person. So the thing is, how do we own this ourselves so that we are not successful when we successfully evade government, but we are successful when we care for others and we stay home? That's really what we are talking about. And when you see these cases rising, it means that we are not caring for others. So my plea is, let's not watch the government and listen to government and wait for their orders. Let us stay home by loving and caring for others. That is the way to do social distance. Care and love for others, and therefore give them social distance, so that as you save yourself, you save the others. It is about us. It's about us. It's about us.
That's a perfect segue for my next question, Dr. When you see 50 escapees jump a wall and blend into the crowd and basically disappear, 2 of them were arrested today, but when you see that sense of irresponsibility, what does that say about us?
Let me take a kind of a slightly different view. So number one is that we need to understand that this is about us, Jeff. So therefore, you can, in a way, say all of us, we are being irresponsible and not taking the measures we need to take. But let's also take a different view that, and I have communicated this to the people, who are taking these steps, that if I go and find somebody who is generally not a medical person, not an epidemiologist, not a public health person, not a health worker, and I put them in a quarantine center and I test them, and then I don't talk to them for 3-4 days, so they don't know what is going on, it creates a certain level of anxiety. That's why we have talked about psychosocial support, because you're not used to being quarantined in a room on your own, and then if there's no continuous communication back to you, then it creates anxiety, and you start to see people. You saw the video circulating of a gentleman called Kelvin, who was saying, I have not being treated. They told me I'm positive. If this disease is so serious, how come they're not treating me? So I don't have it. So which speaks about a lack of information, emotional support, and therefore the most important thing that we need to do, Jeff, to avoid this recurrence in the future, other than what the government is doing by getting these people back, it's about ensuring that everybody in quarantine or isolation, it doesn't matter whether they are positive, they're waiting to be tested or not, requires a basic package of information, which says, this is why you're here, this is why we are keeping you here, this is the next steps, this is what we are going to do after the test, and this is how long you may stay, and these are the steps you need to take, so that everyone understands that we are in this together. It's not a government action to put you in quarantine, it is actually an action to protect you and protect others. So I think, we need to urge the government to actually provide support and information and compassion to other people who are actually in quarantine and isolation, so that we can reduce what we then see as irresponsibility. Even as we tell people they're irresponsible, let us support them to reduce their irresponsibility by giving them the necessary information, compassion, and support for them to understand why they're in isolation and quarantine.
Okay, Doc, let's jump overseas for a moment, if you will, and go to a country where healthcare is absolutely 100% free. I'm talking about the UK, right? Today alone, 759 deaths. Overall in the UK, 18,000 deaths. The US, 46,000 right now as we speak, deaths. God forbid, can those kinds of numbers get here?
Yes, Jeff, they can. And, we don't want, what my personal view is to project or to use models that project rates of infection and to avoid projecting death, because then, people don't understand when you project numbers of death. So I'll avoid that, but say that, yes, it's possible that this infection, this pandemic can take a very negative turn for any country, including Kenya, if we individually do not own this response and all go to war individually. We are all soldiers in battle. Of course, they are the frontliners. Those are the health workers, all the way from the community health workers, all the way to nurses, clinical officers, doctors. Those are the frontliners. But yeah, all the soldiers in the battlefront. If we do not take our role of being soldiers in this battlefront, then this could happen to us as well. We've seen with the numbers we already have about 14 or so deaths. And when you spread out these deaths, a majority of them are above 60 years, obviously. I think 40 or so percent are above, they're above 60 years. But there's still deaths below. There's still deaths below 60 years. So no one is safe. Now, and remember that, as you've referred to, let me just paint the picture, Jeff. Kenya, we spend total, if you look at total expenditure in health per individual, if you take our 47 million people, divide the amount of money spent in healthcare, both in private and public, we spend about 7,000 shillings per person per year. The government out of that maybe spends about 3,500 or 4,000 between counties and national. The US spends $1 million per person per year, $10,000. About half of that is private sector. The other half is public. The UK spends 400,000 Kenya shillings per person per year. So when you compare the health systems, we are dwarfs in the health system when you think about the expenditure in Europe and US, which then brings the question about that we need to even be more responsible, more responsive, more engaged to reduce to flatten the curve even further. A flat curve in the UK is a very high curve in Kenya. So even as we talk about flattening the curve, we must remember and ask ourselves, how flat is the curve? And the curve is flatter for a country that has a lower health system capacity than another one. So our curve needs to be even lower. The curves in some of the countries in sub-Saharan Africa that spend even less than us, countries like Malawi, South Sudan and others, will even need to be lower than the Kenyan curve, because we are not saying about flattening the curve is not ending infection. It's about reducing the rate of transmission so we don't overwhelm the health system, the health workers, the hospitals. So let us remember, it is in our hands to ensure the transmission rate is low enough for us to be able to take care of those who need our care. And also by keeping the curve low, we also protect our health workers, because the more we become, we don't obey, and the more infections we get, the more isolation we require, the more we put strain on the health workers. Remember, they have families, and many of them are preferring not to go home, to stay actually around the hospital so that they don't go infect their children. Think about them when you take these actions you're taking of going to the bar and going and celebrating that you managed to expense the curfew. It is reckless for you to celebrate, beating the curfew. You should celebrate responsibility. You should celebrate care and love and compassion, Ubuntu. That's what we need to aim for.
Absolutely, Doc. Let me go to some tweets because they're coming in very thick and very fast, Doctor. This is Salman Metobo. He says, could it be people are not reporting symptoms because of the fear of quarantine? Lately, the government has been using quarantine as punishment for offenders, he says. Doc?
Yeah, I mean, this is what I just talked about earlier, that there is obviously the possibility, and I think I was looking at this recently in a presentation I was making, and I was saying that there are several things that could make people fear to come forward. One of them could be cost of healthcare, which is why we always say that to avoid pandemics and to make sure that they're under control and that people participate is universal health coverage is a good way of ensuring everyone has a social health insurance cover, and therefore they're not worried about, if I'm put here, how do I pay? So that's one thing that we need to work on as a government and accelerate, having everyone having some form of social insurance so they don't have to worry. So that's one. Secondly, could be how people seem to be treated, and therefore the compassion, information and support I was talking about for individuals who are or required to go to quarantine or isolation needs to be at the maximum, because the individual needs to understand, I'm doing this for my sake and for the sake of those I love. In some countries, we saw the countries following home quarantine or home isolation, where you say you're positive, but please stay at home and your family takes care of you in a different room. But we know that's not possible in our setup, because there's no different room. Majority of our people live in a single room, many of them. So that's not going to be possible, which then leaves us one option: separation from your family. That creates anxiety. That creates, a very difficult, can even create depression and mental illness. So, and remember that none of us is safe until all of us are safe. So the point is, let us make all of us, including myself and the government and everyone, we must make quarantine and isolation understandable, and we must make it compassionate, because then people take the step forward knowing I'm doing this for love, for care of my other people, or of the people I love. So very valid point. We have to make it compassionate, understandable, and daily information. And we are going to be supporting these quarantine centers ourselves as Amref and others, and the government and all the people, so that we make sure the people in there are treated with compassion and love, because they're not there for any mistake they performed. They're there because they may be exposed, and we want to make sure we remove them from the community to reduce the rate of transmission. Secondly, make sure that no one has to worry about how they'll pay for it, and that is universal health coverage. Then people don't have to worry coming forward, because they care about their health and the health of others.
All right, thank you for that. Kennedy Okinda7 says, please ask Dr. about the possibility of malnutrition also rising as a result of COVID-19 crises, as Amref has been on the forefront in malnutrition prevention.
This is obviously worrying, and there are many fronts to this malnutrition question, and thank you very much for asking such a profound question. Number one is, remember that parents always need to work and to earn to feed their children. And as the situation continues to be more and more difficult, as we continue to social distance, as we continue for companies to suffer, the economic slowdown that we are seeing, as people continue to lose part of their salaries or lose their jobs, we will have parents making choices, and those choices could include what kind of food do I feed my children and how often. So that is a big risk, and that is why I'm happy Jeremy on this call, because he's in the National COVID Fund, because they're looking at how do we raise enough money to ensure that we provide social welfare to people, and that social welfare should include food rescue. That's really critical, and we should look at what type of food we give the people, not just ordinary food, especially because we know they're going to be difficulty. Foods rich in proteins are the ones that the COVID-19 Fund and others and like ourselves should actually be looking at, not just buying any food and taking to the people. The second element is that we have women who are breastfeeding. If they can't feed enough, then they are going to maybe make choices about how often they breastfeed their children. If you have a malnourished mother, then breastfeeding a child becomes even more difficult. And that we know that breastfeeding is actually the foundation for nutrition. It's not even, if you avoid breastfeeding a child in their first 1,000 days, then you end up with chronic malnutrition, and you end up with a reduced brain activity because of losing cognitive ability. The brain develops in those days. So we must support breastfeeding mothers. So if the government and the COVID-19 Fund and all of us can identify all mothers who are breastfeeding and make sure the ones who are vulnerable are provided with highly nutritious diet, we will avoid a crisis, as has been raised. The final point is that kids are out of school. You don't know how many children actually in this country go to school, including some of us went to school because there was porridge or there was some form of food in school. Because when you stay home, there's no food at home because the parents are poor. But in a collective manner, schools are able to provide some food to the young people. So the absence from school could also be another cause for malnutrition. So all these things need to be looked at, and it is an extremely important point that has been raised there.
Let me ask you this question before I let you go, Doc, real quick. How long do you think it'll take to tame this virus? And I want a guesstimate from you, because people want to know when life will go back to normal, lifting curfews, opening schools, opening bars and restaurants, lifting the Nairobi-Mombasa blockade. Are we talking a month, 2 months, 6 months, a year? What's your guesstimate?
Long, Jeff, long. I think what we have seen, and somebody asked this question, actually. I had a debate on Facebook today with some people, and they were saying that, for example, there is this myth around vaccines, and I've seen a lot of people saying, this has been created so that vaccines can be sold. Let me just make it very clear that if you look at measles, and all of you listening to us now, if I ask you how many people you've seen with measles, there are very few. But measles, if you have one infected person, they can infect 18 people. Actually, measles is more infectious than the coronavirus. So the only reason we've been able to put measles under control is because of vaccination. And somebody asked me, so why are we not getting a vaccine for HIV? HIV virus is very different from coronavirus. So let's remove that. But let's say that until we have a vaccine that makes us immune to the coronavirus, it is already in our community. Whether you open, even if you close your borders, how long can you close borders? So even if we manage to contain it here and therefore we had no new infections, you'll open borders and you don't know how Tanzania will have managed it, or another country, or Uganda, and therefore you still be open to getting new viruses and infections. So we expect, Jeff, that the measures that are being taken now are going to be long. I estimate it could be up to 4-6 months. But remember that even as those measures become removed, we will get a second wave of infection, because the people who are not exposed and therefore have no immunity will still get exposed to people who may have the virus and they are symptomatic. Therefore, you get a second wave. And therefore, you may see these recurrent waves. So the governments will want to open up the economy a little, and they will do so, and for good reason. But then after some time, you'll see a resurgence. The government will put the measures again until when we know that we can have the virus, or we have been at it long enough for almost 60% of the population to have been exposed to the virus. And then at that rate of 60% of the population having been exposed, it means that there are not enough people to be infected by someone infectious, and therefore it slows down. That's now what we call herd immunity. So we have two options. Go through these waves over time. Each wave could last 3-4 months. So I told people you need to plan with this going on for 4 to 6 months. It could be shorter. I always like to be pessimistic and maybe we surprise ourselves, but plan that long term. And secondly, remember that this could happen over and over again, and that we could all eventually, if there's no vaccine in the next 2-3 years, we could all eventually be exposed to the virus. That doesn't mean we'll all end up in hospital. 7 out of 10 people have no symptoms. So even if you find the virus, your only risk is passing on to people who may be more vulnerable. So so therefore we don't think that when you have the virus, therefore you have to be admitted in hospital. No. But when you have the virus, you're infectious. So slow down the movement. Let us care and love for each other. But we are going to be at this for some time, and life is going to change. You'll see maybe planes, Jeff, saying now no longer people can sit next to each other. So you might have economy seats, having a middle seat. You may find that, even when people are in school, we may say this number of kids cannot be in the same class. So those, even as we go back, remember that there will be measures that could reduce or increase social distance between people that will affect the way we shop, the way we go to school, the way we travel. Maybe reduce a matatu might have only 6 or 8 people. These things are going to come. So we need to be prepared that this is not a 21-day response. It is much longer than that.
Absolutely. That's the grim truth and the reality that faces us in the future. Dr. Githinji Gitahi, thanks so much for your time. Appreciate it. Good luck and stay safe.
Thank you.